ka National Health Mission jong ka jela kala rakhi ka World TB Day menta ka sngi halor ka phang padeng ka baong Yes We Can End TB balapan ya da ka CNDST lab HRP Chest Hospital Shillong agni sngi lai don lang Uram Kumar IES ubadai director katanat NHM but Secretary of Health and Family Welfare jong ka sarkar jela nangta Dr. FV Kharshieng DHS MCH and FW come join MD NHM Meghalaya Dr. J Kharwanlang State Tuberculosis Officer but Dr. B Shanpru District TB Officer Iskhasil District Harangkat ke jingdan langru jong kinong tray jong ka RP Chest Hospital but kiwei habakren hagni gisngi nagalyang Uram Kumar ulaong baka jela bat kari hibro kawai kala page bat kmi ibniya bhaban pendu no ya kani ka jingpang bat kumjuru ban tes ya baro ke bayo ya kani jingpang khnang ban la ban ai jing sumar ki ulaong ru baka jingpang tibi ke dai ka jingpang kabala ban pynkoit bat ke bayo ya kani jingpang ke dai ban shim khia ban pha sumar bat bandi bha ya ki dawai.
To mark World TB Day, we are reminded of the formidable challenge that tuberculosis poses to global health. However, we are also inspired by the theme of this year's World TB Day, Yes, We Can End TB. These words encapsulate the collective determination and resolve of the individuals and the nations around the world to overcome this dreaded disease once and for all. The fight against tuberculosis is one that demands our unwavering commitment and collective action. Despite the progress made in recent years, TB remains one of the top infectious killers globally, claiming the lives of over 1 million people each year. India accounts for more than 28% of the global burden, with mortality of 494,000 in the year 2022. A steady increase in drug-resistant tuberculosis cases further threatens the progress towards a TB-free India. India bears 27% of all the global burden of multi-drug resistant TB, with an estimated 124,000 people who developed the disease in the country in the 2019. To combat the emerging threat of DRTB, the program has decentralized DRTB services with an aim to improve access, minimize number of patient trips, and maximize the patient satisfaction at all health centers. Closer home, our state had notified 4,974 cases in the year 2022 and 4,812 cases in the year 2023. The presumptive TB examination rate per lakh had jumped from 646 per lakh in the year 2021 to 1,433 per lakh in the year 2023. The government of Meghalaya has made available the NAT, that is the Nucleic Acid Amplification Test Machines, which are state-of-the-art molecular diagnostic machines up to the block level, and today there are more than 56 NAT machines across Meghalaya. Despite the presumptive TB examination rate increasing double and use of high-quality diagnostic tests, the notification rate showed a decline from 130 per lakh in 2022 to 124 per lakh in 2023, reflecting an overall fall of TB incidence in the state. This was further evidenced when the subnational certification of progress towards a TB-free status initiative conducted, and 4 districts of Meghalaya were awarded for decline in their TB incidence as compared to the baseline values of the year 2015. To further boost case-finding efforts in our state, NTP Meghalaya has strategically partnered with HLL Lifecare Limited to deploy mobile digital X-ray units equipped with artificial intelligence-based technology to 5 districts of Meghalaya. This initiative will not only enhance the TB case detection rate, but will also help in capturing the missed cases while serving as a bridge to connect and reach the otherwise unreached areas of the state. This project is provided free of cost to the people, thereby ensuring zero catastrophic costs. Meghalaya has taken conscious steps to ensure early diagnosis of drug resistance among all diagnosed TB patients By providing rapid molecular technology, CBNAT, TrueNAT, line probe assay at decentralized level with the help of a strong specimen collection and transportation mechanism from the first point of contact where the patient chooses to seek care. Our state has partnered with an NTEP accredited laboratory at Nazareth Hospital Shillong for LPA, both first line and second line drugs since March 2013, and also for follow-up liquid culture since March 2016. Today, we are proud to announce that we are finally inaugurating our very own TB culture and drug susceptibility testing lab. This inaugural is a significant milestone in the fight against tuberculosis. To reinforce the goal of ending TB by 2025, preventive measures like TB preventive treatment (TPT) have been strengthened and expanded to all household contacts of microbiologically confirmed pulmonary TB case. India has the highest estimated burden in TB infection globally. The National TB Prevalence Survey of 2019-21 of India estimated that 31.3% crude prevalence of TB infection among the population aged 15 years and above. Current rate of annual decline in TB incidence is approximately 2%. However, with proper implementation of TPT, the annual decline in TB incidence can go down to 8 to 10%. Meghalaya has a robust system of providing TPT to all the household contacts. Till date, the TPT coverage amongst household contacts in our state is 52% against the national average of only 27%. Multi-sectoral collaboration.
Very warm good afternoon to everyone. I'm very glad that on this day we are able to inaugurate the CNS-DSD lab, Culture and Drug Accessibility and Sensitivity Tests Laboratory. First of all, I'd like to recognize all those who are on stage, our directors, my colleagues, Dr. Rilin, Dr. Kashing, Dr. Karluki, the ex-STO, Dr. Mori, Dr. Jennifer, and Dr. Amika for a very comprehensive Master of Ceremonies. In fact, almost I think a year and a half back, when we was doing this regular TB reviews, I think one day I found a nice book on TB, Phantom Plague, and we gave it to all of them. I'm happy that someone read, Dr. Amika, I think, read the book. I saw in the initial takes a lot of the information what you mentioned was from that book. I'm very happy that, because reading is something we have to do on a regular basis, both for a very knowledgeable leisure and for work, to keep ourselves updated. It's a very, very changing world and very fast changing world, and to have comprehensive understanding on something, reading is so important. I'm very happy, Doctor, that you have taken that effort to read it. And Dr. Jennifer already mentioned in detail about the efforts which has gone into the TB elimination program. It's not anymore TB control program, it is TB elimination program. From the national level, from the state level, we have had very, very clear vision that we need to end TB in a comprehensive manner in the country. And for that, whatever steps we need to take, we'll have to take. This is a disease which is this is the oldest disease known to humankind, which since documented history we have had things about disease which Dr. Amika already mentioned. And we need to ensure that these, we have sufficient systems in place to address this disease. Now, when actually COVID happened, we actually found out that was the initial times when I had actually joined as mission director. In fact, there is one more occasion. This is exactly the 4th year I took over as MD NHM. 19th March 2020, I had taken charge as mission director during COVID times. And when we were trying to understand COVID and how it functions and everything, it was quite strange that someone said that it is almost just like TB. You have to, if you know the person, you have to do what contact tracing. You have to find out who are the high risk contacts. You have to do susceptibility testing. You have to do presumptive testing for them. You have to isolate them. That is how you cure it. Then I said, like, then why does TB not get this much of attention which it's supposed to get? Because this is one bacteria which is evolving along with humankind, and sometimes much more stronger, where we might have situations where we'll not be able to save people. So it's very important that we have enough systems. One of the reasons why the enough attention it does sometimes doesn't get from the right stakeholders is it is also a kind of it used to be, it's not anymore, it also used to be a kind of a poor man's disease, where there is a lot of crowding, where there is a lot of facility transmission, where there is people do not have enough private spaces to live. That is where the spreading is faster, that is where the spreading is higher. But today, those things have gone that, it is not anymore a poor person's disease at all. It can come to anyone. It can come to anyone. Most of you are working in hospitals or know about it much more in detail than I do. You can go to a hospital, any hospital, and there is chances if the hospital doesn't have enough infection control mechanisms or anything, we can catch this MDR TB even from water source, other sources, and etc. It is a very, very serious issue. So we need to have constant awareness, constant systematic steps to tackle this issue. Now, 2-3 things are very important is what I feel. One, in TB, we need to demystify this disease even further in a language that communities understand. That is why the TB TB free village panchayat or villages program has started. We are already there, about 250 villages will get the TB free village status. But people have to understand TB in much more simplified manner. Until that, it would be very difficult for us to take this as a public health movement. This is such an important task. So the main challenge is to demystifying it and telling people that it is serious. If someone at home have had TB, we need to be, because this has a long dormant period. It can be there in body for 10 years, 15 years. It will not manifest immediately. After that, it will manifest. And TB can be cured. That is also something which we need to know with the proper treatment regimen. The treatment continuity has to be there, and it has to be made this proper treatment is possible to do until we take it systematically and do that. And also people with HIV are very highly susceptible to TB, and there also it's there. We already had a district which got the award for the highest number of HIV people with HIV testing. These are important things which we need to do both from the community side as well as from the clinical side. These two things has to have a very good connection. Unless we have that, we are going to have cases come here and there, or it is going to manifest in different manners. That's why infrastructure like this, culture and drug sensitivity laboratory, we need to test for almost all cases wherever they have a certain threshold to see whether, what treatment regimens we can have for people so that they might get into the treatment much earlier and it can be actually cured. That lab has taken some time, as Dr. Amika and Dr. Jennifer also pointed out. It was not an easy journey, it was a little windy, long journey, but I'm happy that we have the second BSL-2 laboratory. For those who have joined here, in entire Meghalaya, we used to have only one BSL-2 laboratory, which is where was in Nagrims before COVID. Today we have 3, in fact 4 we have. We have one in Tura, we have one in Pasteur laboratory, we have one more now in CNSDSD now. So we have 4 BSL-2 laboratories. It's not this thing, it is in 4 years we have added so many laboratories along with NAT testings.